Hi, my name is Carolyn, and I'm a practicing oncology nurse. One of my many roles is helping my patients get ready for their chemotherapy treatments. And the first thing that I always tell them is that our practice has a zero tolerance policy when it comes to chemotherapy-induced nausea and vomiting. There are medications to prevent it. Today, I'm here to walk you through how to use Sancuso, one of the most recent advancements in the prevention of chemotherapy-induced nausea and vomiting. Your doctor may have prescribed Sancuso to help you manage nausea or vomiting associated with your chemotherapy treatment. Sancuso is different from other medications because when it is properly applied, it can prevent nausea and vomiting for 5 days in a row. In this short video, I'm going to show you how to properly apply Sancuso. Sancuso is simple to apply, but you may find it easier to ask your nurse or someone close to you for help. Make sure anyone assisting you is familiar with these instructions. It may also be helpful to refer to the Sancuso patient education brochure. This brochure, like the video, provides information about applying Sancuso and other important information. The first thing to do is to plan to apply Sancuso a minimum of 24 to a maximum of 48 hours before your scheduled chemotherapy treatment. I always suggest that you use a calendar or a day planner to help you keep track of your Sancuso application, as well as your chemotherapy appointments. However, it is always important to follow any additional instructions that your nurse or doctor may have given you. If you have any questions, you should contact your nurse or doctor. Before applying the patch, make sure to choose an area of clean, dry, healthy skin on the outside part of your upper arm. It should not be oily, recently shaved, or have any skin problems such as cuts, scrapes, or irritation. Make sure not to put Sancuso on areas that have been treated with creams, oils, lotions, powders, or other skin products, because these products could prevent the patch from sticking to your skin. Unless you are ready to apply Sancuso, do not remove it from its pouch. Also, you should never cut Sancuso into smaller pieces. When you are ready to apply Sancuso, remove the pouch from the carton. Then, tear the package open and remove the thin, clear protective liner to expose the printed side of the patch. Throw out the liner. You'll notice that the unprinted sticky side of the patch has a two-piece cover. Bend the patch in the middle, remove 1/2 of the rigid plastic film, and apply the patch to your skin, being careful not to stick the patch to itself. Make sure to avoid touching the sticky side of the patch with your fingers. Once the patch is in place, remove the second half of the rigid plastic film and press the whole patch firmly in place with your fingers and smooth down. Be sure to wash your hands after applying the patch. There are a few special instructions that you should be aware of when wearing Sancuso. You can bathe or shower as normal, but you should try to avoid immersing the patch in water for long periods. Since the active ingredient in Sancuso may be affected by direct sunlight or exposure to sun lamps, you should keep the patch covered under your clothing and keep the skin where the patch was applied covered for 10 days after removing it. You should also avoid strenuous exercise, swimming, and sauna or whirlpool use. If at any time the patch becomes loose, you may secure it using surgical bandages or medical adhesive tape to keep it in place. If the patch becomes lost or damaged, contact your nurse or doctor. When it is time to remove Sancuso, gently pull it off your arm and fold it in half before throwing it out. If any sticky material is left on your skin, gently wash the area and your hands with soap and water to remove it. There are a few things you should be aware of when you remove Sancuso. You cannot reuse the patch once it has been removed. After removing the patch, you may notice some mild redness, but it should fade over time. However, if itching or irritation continues for any length of time, make sure to call your doctor or nurse. When using these simple application instructions, Sancuso can help prevent chemotherapy-induced nausea and vomiting for up to 5 days. I hope that you feel ready and prepared to apply Sancuso when necessary. If you have any questions, make sure to call your doctor or nurse before applying Sancuso. Thank you for viewing this video. If you would like to find additional information about Sancuso, please visit www.sancuso.com.
Sancuso is indicated for the prevention of nausea and vomiting in patients receiving moderately and/or highly emetogenic chemotherapy regimens of up to 5 consecutive days duration. Do not use Sancuso if you are allergic to granisetron or any of the other ingredients of Sancuso. Do not use Sancuso if you are pregnant or breastfeeding unless your healthcare professional has told you that you can use it. Tell your healthcare professional if you are pregnant, if you plan to become pregnant, or if you are breastfeeding. Tell your healthcare professional if you have pain or swelling in stomach area, or if you are allergic to medical adhesive tape, adhesive dressings, or other skin patches. Tell your healthcare provider about all medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. Other medicines may affect how Sancuso works. Sancuso may also affect how your other medicines work. The medicine in Sancuso may not work well and/or may affect your skin if exposed to direct sunlight and the light from sun lamps or tanning beds. While wearing the patch, keep it covered with clothing if you will be in sunlight or near a sun lamp, including tanning beds. Keep the skin where Sancuso was applied covered for another 10 days after the patch is taken off to protect from exposure to direct sunlight. You may see mild redness on the skin where the patch is removed. This redness should go away within 3 days. If redness continues, tell your healthcare professional. The most common side effects of Sancuso are constipation and headache. Tell your healthcare professional if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Sancuso. For more information, ask your healthcare professional or pharmacist.